A phlebotomist is a trained healthcare professional who draws blood from patients for laboratory testing, transfusions, donations, or research. The role appears simple at first glance, yet it requires technical accuracy, emotional composure, and strict attention to safety. In clinical settings, the phlebotomist often becomes the first point of human contact, transforming an anxious encounter into a medically orderly procedure. The work begins with preparation. Before a blood draw, the phlebotomist confirms the patient's identity, reviews the request, and selects the appropriate equipment. A calm and respectful manner is essential because many patients arrive fearful of needles or uncertain about the purpose of the test. The professional must therefore combine procedural competence with interpersonal tact. This dual responsibility distinguishes phlebotomy from purely mechanical tasks. To become a phlebotomist in California, a person generally begins with a high school diploma or equivalent. The next step is to complete a state-recognized training program. California regulates phlebotomy more strictly than some other states, so the training must meet specific requirements in classroom instruction and supervised clinical practice. The program teaches anatomy, infection control, specimen handling, safety procedures, and patient communication. After training, the candidate must complete the required number of successful venipunctures and skin punctures under supervision, as mandated by California standards. These clinical requirements are designed to ensure not merely familiarity, but demonstrated skill. Once the practical experience is complete, the applicant usually seeks national certification through an approved certifying organization because certification is commonly required for state certification and employment. The final stage is obtaining California certification through the appropriate licensing authority. Applicants typically submit proof of education, training, clinical experience, and certification, along with the required fees and documentation. Because regulations may change, it is prudent to verify the current requirements through the California Department of Public Health before enrolling in a program or applying for a certificate. In professional terms, the phlebotomist occupies an important position in the diagnostic chain. A correctly collected specimen can guide treatment, while an improperly collected one can delay care or produce misleading results. For that reason, the occupation demands precision, reliability, and ethical responsibility. For individuals who value healthcare work, want direct patient interaction, and are prepared for careful technical practice, phlebotomy offers a practical entry into the medical field.